So, are you coming more quickly than you want to? Would you like an effective cure so that sex can last longer and you can enjoy it properly? Well, you've come to the right place. I've been helping people for the last 20 years with their sexual problems, and premature ejaculation can rip the heart out of a man and stamp on it. It's an awful condition, really upsetting. And I'm going to talk to you in the next few minutes about the effective cures that can get your premature ejaculation better, and I'm also going to expose some of those things that don't actually help. My name's Simon Snook. I'm a sexual and reproductive health specialist, and this channel is the Kiwi Sex Doctor, where I give you tips, tricks and hacks for a better sex life. Now, I've got another video which talks about why people get premature ejaculation. In this video, I'm just jumping straight to the punchline and talking about what you can do to make it better. But if you do want to understand a bit more about why it's happening to you, then have a look at the link below, and then you can have a look at that other video and come back to this one. But now, for the cures. So guys have a sort of an average time that they last. Everyone has their own average time, same way that some people are taller or shorter. Now, the time that you do last can change from one time of sex to another because of other factors, but you're always going to be around about the same point. What we're looking at in today's video is how to lengthen things out and make it last a bit longer. But first, I want to dispel a myth. One of the most common things that people try and do as a self-treatment is called the squeeze technique. And essentially, this has been around for decades. The idea that to try and fix your premature ejaculation, when you're having sex, when you feel you're getting close to ejaculating, you pull out, you squeeze hard on the tip of the penis to try and reduce the sensation, to try and sort of push you backwards down the hill before you jump over the top of it. And then as things calm down, you start having sex again. And, you know, all right, it'll stop you coming that one time, but it doesn't train you. It doesn't train you to last longer. It just turns sex into being the sexual equivalent of driving through downtown Los Angeles. Just stop, start, and you never really get anywhere. So if you've been trying that and wondering why it hasn't worked, it's because it doesn't work. So what does work? Well, let's start with the simplest of things. If you've ejaculated within the last 24 hours, that's generally going to make your next ejaculation take a bit longer. And you can use that as a way of kind of making your sex last longer. Either have sex very frequently, or the other hack that a lot of guys have used way back to year zero has been to masturbate a little while before expected sex, which will help slow you down. And that can clearly work. The problem, of course, is if you do it too close to when you're going to have sex, it can cause problems with both your libido and your interest in having sex because you've only just ejaculated, and it can cause problems with erectile dysfunction. So you've got to get your timing right and know yourself. But it's a very simple hack that probably most guys with premature ejaculation have tried, but it is something that still is worth looking at. Another really common thing is the stress and worrying about having premature ejaculation kind of makes things worse. All of the positive stuff that makes you get towards ejaculating, like how things feel, how they smell, etc., are good. But if you add in stress about worrying about it, that's like kind of boosted up again, and it can make you come even quicker. Now, there is no point telling someone, don't stress. I mean, it's a ridiculous thing to say. You have to look at ways to get around that stress. Most importantly, and probably self-evident to a lot of guys, but you'd be surprised how many people don't go down this way, is talk to your partner, explain that you're worried about how quickly you come. Just sharing that worry can often make the level of anxiety around sex decreased. You may even find that your partner doesn't think it's anything like as much of a problem as you do, and that also can help. The second thing is, remember that from a woman's point of view, the vast majority find it easier to reach orgasm through clitoral stimulation rather than penetration with the penis. So think about ways that you can pleasure your partner without penile penetration, using your hands, using your mouth, using sex toys. Look at other ways, and if you know that your partner is reaching sexual pleasure, again, that takes some of the pressure off of how long you're inside the vagina. And finally, when it comes to stress, think about mindfulness and meditation. Practice that away from sex. Get into those good breathing techniques, get into that sense of relaxation, and then as you get good at that, you can actually bring that into your lovemaking. Now, as I've said, the point of getting to ejaculation occurs through increasing excitement as you're having sex, and that excitement comes from what you're thinking, how things are looking, what you're smelling, and probably most important of all, the physical stimulation, especially the stimulation to the penis itself, the rubbing on the penis. Now, if you can reduce the sensitivity of the penis, that can also help slow you getting to that point of ejaculation. And you can go simple things like using a condom that gives that extra barrier, that reduction of the sensation of the skin on skin with the penis and the vagina. Or you can even add in a local anesthetic gel to put on the penis before you have sex, which then numbs it down a bit and you don't feel quite so sensitive. You can get these gels from pharmacies, you can get them from adult shops, and you'll even find that some specialty condoms have these gels inside of them as well. Anesthetics like benzocaine and lignocaine tend to be the ones that work the best. But if these simple measures aren't working for you and you're still suffering from premature ejaculation, you might want to look at medications. Now, we are lucky that we have some very effective medication treatments for this. The main group, or the main groups, are types of antidepressant that have sexual side effects, one of those side effects being slowing down the ability to reach orgasm. We can use that as a positive effect for people with premature ejaculation. Now, the two main groups of antidepressants that do this the best are those called the selective serotonin reuptake inhibitors, or SSRIs, or the tricyclic antidepressants, or the TCAs. Now, there are a number of different medicines within each of those groups. In the SSRI group, there's fluoxetine, there's paroxetine, citalopram, escitalopram, and the list goes on. In the tricyclic group, there's amitriptyline, nortriptyline, clomipramine, imipramine, and again, the list goes on. Each one of those medications has slight different side effect profiles and may have different interactions with other medications you're on, or be more appropriate or less appropriate for you. What is important to realize is they're pretty much all the same in terms of how effective they are at treating your premature ejaculation. So it's more about which one would suit you the best. And obviously this is something that you would talk about in discussion with your doctor, who will know your other health issues. And it may well be that you try something and then you find that you don't get on with certain aspects of it and you can try something else. In view of how you're taking it, you have a couple of options. You can take these medications as needed. In other words, if you know when sex is going to happen, you take one of these medications an hour or so before sex and the effect will kick in time for you to have sex. Therefore, you don't have to take the medication every day. However, if your sex life is such that you're having sex more frequently, or that your sex is much more spontaneous and you don't necessarily can plan an hour ahead, you may want to take these medications on a daily basis so it's always in the system. Again, that will come down to your individual needs and what would work best for you. The medications have a fairly classic dose response, i.e. the more you take, the longer it will take for you to ejaculate. So you can work for yourself and find out how effective it is, and you can increase the dose, again, obviously in discussion with your physician. One word of caution though, of course these medications do have a lot of effects and a lot of side effects. And they also have sexual side effects. Now, obviously, in this case, we're using the fact it slows down your ejaculation as a positive effect. Some of the other side effects of antidepressants can be that they reduce your libido, or that they can cause problems with erectile dysfunction. So it's important to know that before you start, and be aware that although it can be very helpful for you from a premature ejaculation point of view, there may be other issues. But it's certainly worth considering, and if you've got to this stage in the list and you're suffering from premature ejaculation, you may well be keen to try these things out. There is one other group of medication, or one other specific medication that's very effective, which is called tramadol, and that's a synthetic opiate. It is very, very good at slowing down the ejaculation time and misses out on a lot of the other side effects you get with antidepressants. Of course, the problem is, especially now, with our opiate epidemic, using a medication such as this for premature ejaculation does run the risk of significant worry with regard to addiction. So it really has limited the use of this, which would otherwise be a very effective drug. So look, I hope that little run through of treatments has helped you. The important thing is you can find something that will make your premature ejaculation better. I hope you found that useful. Please do give us a thumbs up if you have done so. I really appreciate that. Place any comments you might have or any questions you have about other sexual problems down below, and we'll get back and see if we can answer those for you. The important thing though with premature ejaculation is realize you are not on your own, and there are treatments out there. So I hope this has been helpful. Thanks for watching. I'll see you again next time.